So the symptoms of the cold that we frequently have, the flu and the COVID-19, have got quite a number of overlaps. Therefore, symptoms alone cannot confirm whether a person is having the novel coronavirus or the nCoV infection. There has to be an array of symptoms which need to get weaved together to have a confirmed case of the coronavirus. And this can only be done by healthcare specialists. So in this video, we will first separately go through the symptoms of the cold, the seasonal flu, and the COVID-19. Then we'll try to understand the overlaps between the three diseases. After that, we'll see what is acute respiratory distress syndrome. And finally, we'll try to draw a conclusion and see how are we supposed to act in the pandemic situation. So, starting off with the cold, while you may feel miserable when you have a cold, the symptoms are generally mild compared to more aggressive viruses like the flu. The symptoms when a person has cold are runny or stuffy nose, mild cough, sneezing, watery eyes, sore throat, and sometimes aches and pains in the body. Most over-the-counter medications have, at best, moderate effects on cold symptoms. A typical cold will last on an average of 7 to 10 days. The majority of the symptoms are not caused by the infection itself, but rather a body's immune system trying to get rid of it. Therefore, we need to give some time to our body to fight off the infection and remain patient unless the symptoms are moving to the next level and gradually becoming severe. Next, for the flu. The seasonal flu or the influenza is still out there and generally comes on fast and rapidly. It is a common respiratory infection caused by a virus that affects the nose, the throat, and the lungs. And this can last for about 5 to 7 days. If you talk about the symptoms, they are fever with sudden chills, dry cough again, fatigue or feeling of tiredness, aches and pains in the body. It may or may not have a runny nose and sore throat, and there are cases where there is diarrhea in case of children. Well, unlike colds and coronaviruses, vaccination is a good way to prevent flu. If you have received a flu shot and still getting the flu, your symptoms are generally milder than if you hadn't received the vaccination. Most people with the flu get well without medication treatment. And now for the coronavirus or the COVID-19. The novel coronavirus, which is causing the COVID-19, is a new strain of the coronavirus that is spreading quickly worldwide. The recent estimates are more than 200,000 confirmed cases all over the world. And 4 other strains of coronaviruses, including types 229E, NL63, OC43, and HKU1, usually cause mild to moderate upper respiratory tract illness, like the common cold. Well, this information applies to the common human coronaviruses and should not be confused with the COVID-19 disease. The COVID-19 can cause severe illness in certain groups. For example, older people and people of all ages with severe underlying health conditions like the heart diseases, lung diseases, and diabetes. The symptoms include dry cough, fever with chills, shortness of breath and breathing difficulty, runny nose, sore throat, and other upper respiratory symptoms are very uncommon in case of COVID-19. Now, if we compare the three, it turns out to be something like this. This chart is published by WHO i.e. World Health Organization, in collaboration with CDC, that is Center for Disease Control and Prevention. So in case of both flu and COVID-19, dry cough is common along with fever. And if someone is having only a runny nose and is sneezing a lot and none of the other symptoms, it is probably the cold. The symptom that stands out for COVID-19 in this case is shortness of breath, i.e. breathing difficulty. Now, adding to that, severe lung damage can cause something called the Acute Respiratory Distress Syndrome, or ARDS, which occurs when the lung inflammation is so severe that fluid builds around and inside the lungs. The severe infection can cause septic shock, which happens when the body's organs are starved for oxygen. So, finally, how are we supposed to act in this pandemic situation for the COVID-19? Well, the severity of the COVID-19 symptoms range from mild to severe. If you have recent close contact with a COVID-19 patient, or you have traveled recently to an area where the disease is active, it may be more likely that your symptoms are due to COVID-19. If you suspect the disease, call the helpline number in your respective country and seek help from clinicians who can review your symptoms and give specific care recommendations. If your symptoms are mild, you will likely to be directed to stay at home to protect others from illness. But if you're referred to a medical facility, to a doctor, remember to call ahead and let them know your symptoms before you go in. Now again, the only way to stop the spread is to quarantine yourself in your home. Second, avoiding social gathering. And finally, preventing to travel to other states or country till the situation is under control.